Hi, I'm Jessie Gruman, president of the Center for Advancing Health. In the Oscar-nominated movie Up in the Air, Ryan Bingham, also known as George Clooney, travels around the country firing employees for company bosses who don't have the stomach to do it themselves. You know, the ones who prefer to outsize the downsizing function. He finds his own job threatened by a hotshot business school graduate who convinces the president of their company that it would be more efficient to do the long-distance layoffs via the internet. Sitting in a hotel bar, our hero makes a passionate speech to his young colleague about how important it is to fire people face to face, that a look in the eye, a few words that personalize the institutional rejection, and a handshake allow them to maintain some small shred of dignity at the very moment that they're losing their identity as a valued employee. Now, this speech resonates with me as I contemplate the waves of email notices in my inbox announcing electronic tools and personalized web-based services and sites that can help me take care of myself. I can take a picture of my rash with my iPhone and send it to my dermatologist. I can check online to see when I had my last tetanus shot or schedule my next mammogram. I like interacting with my doctors by email about minor matters. And I'll tell you, if I lived in the empty plains of eastern Montana, I'd probably prefer often a telemedicine visit with a doctor or nurse over a 10-hour round-trip drive for a 20-minute in-person appointment. But what really takes place during an in-person visit? The physical examination, the conversation, the look in the eye, and the handshake that can't be accomplished any other way. I have a hunch that the value of the in-person firing as opposed to online, that's so passionately defended by George Clooney's character, is dwarfed by the value of the face-to-face, hands-on meeting between me and my doctor or nurse practitioner. That sometimes the interaction between us is a critically important of the diagnosis and the treatment recommendations, as well as my willingness to participate in my care. The active ingredients in that interaction are not widely specified or quantified. And while most people and most health professionals probably share my hunch that in-person interactions are sometimes critical, all of us appear to be willing to forego such contact at different times for reasons of convenience and expense. High cost and poor efficiency are cruel taskmasters, though, and the drive by health plans, the government, and providers to reduce the former and improve the latter is well served by outsourcing interactions between us and our doctors to automated web-based programs and services. What I want to know is, how will they and we know when the balance tips, when the lack of the physical encounter, the look in the eye, the hand on the shoulder, begin to erode the quality of care we receive and the outcomes that we hope for?